Okay, hard question. 21-year-old male athlete, routine sports physical, and he got the dizziness on the workouts, but he denies chest pain. And his father passed away suddenly, 45. Harsh systolic murmur is heard on the left lower border, which decreases with squatting. Okay, so squatting is going to increase the preload. And so if it decreases with squatting, that's a good sign it's going to be hokum. And so which of the following is the most underlying cause of the patient's condition? Okay, so hokum is going to be caused by this autosomal dominant mutation in the sarcomere protein genes. So he's got hypertrophic cardiomyopathy. Basically, it's going to be super big, causing turbulent blood flow, causing other like blood problems and that systolic murmur. So you have these changes in the myosin binding protein and the beta myosin heavy chain, and you have this asymmetrical septal hypertrophy. So there's this obstruction in the left ventricular outflow tract, and the obstruction worsens whenever you decrease the preload. So that's like if you stand up or do the Valsalva maneuver, and that causes like less preload. But if you squat, then it will make the symptoms a little bit better because the preload increases and blood flow continues. Duchenne and Becker's, these are both dystrophin mutations, and they're going to be X-linked. And there's choice C was mitochondrial inheritance affecting ATP production. So that's not going to be related at all, but these are mitochondrial myopathies. And if you have high tissue demands, then you can have neurologic and muscular problems, but not asymmetrical septal hypertrophy. So choice D was autosomal recessive defect in the collagen synthesis. Think Ehlers-Danlos syndrome and osteogenesis imperfecta, which is a type 1 collagen, I believe, problem, and it causes connective tissue disorders and not anything to do with left ventricular hypertrophy or obstruction like in hokum. So sporadic mutations affecting the calcium channels, that would be like Brugada syndrome, and you don't see or it doesn't cause any structural hypertrophy. So basically, if you have hypertrophic cardiomyopathy, you're going to be like an athlete, and it's going to be an autosomal dominant mutation causing the mutations in the sarcomere proteins, and they're going to have exertional. So when they work out, they're going to have syncope, so low blood pressure, dyspnea, and dizziness, and increased risk of sudden death in athletes. You have this systolic murmur that increases whenever you have more blood flow going through it, and you avoid medications that reduce your preload. So what reduces your preload? Diuretics and vasodilators. So stay away from those. And it's a genetic heart disorder. Basically, the heart is super thick in athletes, and also runs in families in autosomal dominant fashion, and they can faint and die suddenly. The murmur gets better when more blood gets through it. Hopefully that was helpful. If so, like and sub.